The national cervical cancer rate has decreased by more than half from the mid-1970s to the mid-2000s. According to the American Cancer Society, this is driven by increased screenings. However, in women between the ages of 30 and 44, rates have been increasing by almost 2% each year from 2012 to 2019. With us today is Dr. Cicy Li, an OBGYN at St. Luke's Women's Health North. Dr. Li, thanks for joining us during Cervical Health Awareness Month.
Well, thank you so much for having me.
So I think what we want to focus on first is cervical cancer screenings and how crucial they are for prevention. What should patients know about that?
Well, cervical cancer screening typically starts at the age of 21, except for patients who have a history of HIV or who are also on immunosuppressant drugs. Usually we do cervical cancer screening every 3 years before the age of 30, and then after the age of 30, we like to do it every 5 years as long as your results are normal. There's two parts to cervical cancer screening. First, we like to look at the cells that we actually get from the cervix, and then we also like to test you to see if you have HPV. We start doing HPV testing after the age of 30, and if both of those results are normal, we can space your pap smears out to every 5 years.
That's great. And the HPV vaccine is another key piece of prevention. What do we need to know about that?
The HPV vaccine is currently approved for people between the ages of 9 and 45. We typically recommend that 11 to 12-year-olds start getting it, including boys and girls. It covers 9 of the most common types of high-risk HPV that can cause cervical cancer and has actually been shown to decrease types of cervical cancer by up to 60%.
That's great to know. And what are some misconceptions about cervical cancer that you want our patients to know that are watching this?
Well, cervical cancer can affect women of all ages. It's not just limited to older women. Women in their 20s, 30s, and 40s can get cervical cancer as well, which is why it's so important to try to get the HPV vaccine when you can and also keep up with your cervical cancer screenings.
That's great to know. What are some additional treatment and prevention options that are available for patients?
Well, I would say for prevention, abstinence and condom usage are probably your best choices, but if that is not an option for you, then definitely get the HPV vaccine. And treatment options, should your pap smear become abnormal and you need treatment for a precancerous lesion, would be like a LEEP procedure or something called a cold knife cone. With a LEEP procedure, we can do that in the office under local anesthesia, or we can take you to the operating room to have that done as well. It takes a long time for a precancerous lesion to develop into cervical cancer, which is why it's so important to get prompt treatment for any of those lesions.
Dr. Li, what else should our audience know about cervical cancer and Cervical Health Awareness Month during the month of January?
Well, I think one of the biggest barriers to care is that women are just not comfortable going to see a gynecologist a lot of the time, especially for that first visit. So I think it'd be a really great idea if mothers could bring their daughters with them to their own pelvic exams so that they can get an idea of what to expect when they come to see a gynecologist. Of course, we do offer visits for younger women as well if they want to come and talk to us beforehand too. We don't want any fear or misconceptions to prevent young women from taking charge of their own health and making sure that they get adequate cervical cancer screening throughout their lives.
Dr. Li, thank you so much for joining us during Cervical Health Awareness Month. We appreciate it.
Yeah, glad to be here.
If you would like to make an appointment for a cervical cancer screening with a St. Luke's gynecologist or to get the HPV vaccine, you can visit stlukeskc.org/gynecology. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.